Hi, my name is Tara Donaldson. I'm in Intern 3 of the Acute Care Adult Gero Nurse Practitioner Program, and I'm here to present a case study on Sandra Hayes. This morning, Sandra presented to the ED. She is a 53-year-old African American female who presented from home with her husband with complaints of fatigue, weakness, and a rash on her arm. She also complains of diarrhea for 4 days, a headache that she rates a 7 out of 10 this morning, and dizziness. Her husband reports intermittent confusion and forgetfulness in the past day or so as well. The fatigue and weakness have been present for about a week. She feels that it has been progressively worsening. She's been needing to rest frequently while performing everyday tasks, and she reports not being able to walk down her driveway to get the mail, and she usually walks 2 miles a day. She noticed the rash on her arm for the first time this morning. It does not itch or hurt. She has had intermittent headaches all week, but today's was worse. The diarrhea has lasted 4 days, occurs about 10 times per day, and has been getting more watery as her PO intake decreases. She's had no recent sick contacts, no known exposures to COVID, no new medications, and she does not have any pets. I conducted a review of systems with the patient and her husband. For neuro, she endorsed headaches intermittently this past week, rating the pain about 4 to 5 out of 10, but her headache this morning was worse, rated 7 out of 10. She did have intermittent dizziness that started today. Her husband notes that she has been forgetful, which is unusual for her, and this morning she wanted to make school lunches for their children, who are now in their 20s. She does report no unilateral weakness, mild tingling in her left hand, no seizures, no tremors. In her head, she reports bleeding in her gums when brushing her teeth that was mild, no visual changes, no tinnitus, no loss of taste or smell, and no neck stiffness. For respiratory, she endorses dyspnea on exertion that has worsened daily this week, no cough, no sputum, no pleuritic pain, no shortness of breath at rest. For cardiac, she endorses palpitations that are intermittent, and she feels like her heart is racing when she's moving around. She does have mild to moderate chest pain with activity. This is new for her. She has had no syncope. For GI, she notes a reduced appetite and endorses 4 days of diarrhea with about 10 episodes daily. She denies blood in her stool, nausea, or vomiting. For GU, she notes no dysuria, no hematuria. She does admit to darker than usual urine for the past several days and less often than normal. Her last menstrual period was about 2 weeks ago, and it was a typical period for her. For musculoskeletal, she reports weakness that has progressively worsened throughout the week, denies myalgias, arthralgias, trauma, or injury. For skin, she endorses a rash on her left arm, no color changes or pruritus. Her husband states that she feels cooler than usual to him to the touch. For peripheral vascular, she denies swelling, varicose veins, or intermittent claudication. For psych, she reports no irritability, no unusual behaviors or personality changes, and the husband agrees. The following are Ms. Hayes' physical assessment findings. For neuro, she's ANO times 3 to 4, Perla, mild weakness in her left arm greater than her right. For her head, she has scleral icterus, and we noted petechiae on the oral mucosal membranes. For respiratory, she has clear lung sounds. Her breathing is unlabored. Chest movements are symmetrical. She is mildly tachypnic at rest with a respiratory rate of 18. For cardiac, at rest, she is tachycardic in the 110s. S1, S2 are noted. No extra heart sounds, no murmurs. For GI, her abdomen is tender, soft, and non-distended. Bowel sounds are hyperactive times 4, and I noted no organomegaly. For GU, she has a low volume of dark urine that was noted on the provided sample. Her urine is otherwise clear and not malodorous. She has no flank tenderness. For musculoskeletal, her grip strength is moderate bilaterally, but the left arm is mildly weaker than the right. The lower extremity strength is about 3 out of 5. For skin, a petechial rash was noted on her left arm that covers her entire forearm. There are scattered bruises on her legs, no wounds, and her skin is cool, especially in the extremities. Peripheral vascular found no edema, but bounding peripheral pulses. For psych, she is calm and cooperative and very pleasant. The patient has a rather unremarkable past medical history. She had 2 pregnancies with 2 uncomplicated vaginal births, both children still living. She has regular menstrual periods with menarche at 13 years old. She has myopia, for which she wears contact lenses. At 17, she had appendicitis and she is status post appendectomy with no complications. She does have hypertension, for which she takes amlodipine 5 milligrams daily. She is overweight with a BMI of 27.5. And at age 22, after having influenza, she did come down with Guillain-Barré syndrome with a complete recovery. Her family history includes hypertension in her mother, father, and brother, type 2 diabetes in her mother and brother. Her mother had pancreatic cancer, from which she passed away at age 76. Her father had AFib and ACVA at age 73, COPD, he was a smoker, and he died at age 80 of COVID. Her brother, in addition to diabetes and hypertension, has sarcoidosis. She has a daughter who's age 22 who has been healthy her whole life. And her son at age 25 has had mild, well-controlled asthma since childhood. For social history, she does not smoke. She drinks socially 1 to 2 glasses of wine on occasion. No drug use. She has been married for 29 years. She's active with friends in her church, and she works as a high school art teacher. She does have some notable lab findings. On her CBC, there was a white blood cell count of 5.7, red blood cells of 2.1, platelets 74, hemoglobin 6.8, and hematocrit of 30. Her BMP had a sodium of 138, potassium of 3.1, BUN was 79, creatinine was 1.23, CO2 was 24, glucose 88. Her magnesium was 1.7. Her D-dimer was mildly elevated at 0.6, and her APTT was normal at 32. Her liver function tests included indirect bili of 3.3, LDH of 1109, ALT of 24, AST of 26, ALK Phos of 76. Her haptoglobin was 19. Her DAT was negative, and a UA was sent that showed tea-colored urine that was clear with trace hemoglobin and was negative for protein, ketones, leukocyte esterase, and nitrites, but positive for bilirubin. In addition to labs, some other initial testing was done, including an ECG, which showed sinus tachycardia with no ectopy, a chest x-ray that had no acute findings, a CTPE, which was negative for PE, and found no infiltrates, opacities, or pulmonary edema. A CT of the head showed a small hypodensity in the left parietal lobe that was suspicious for a bleed. And her vital signs were 36.9, heart rate of 113, respiratory rate of 18, SpO2 of 94% on room air, and a BP of 106/73. So our Miss Hayes, who's usually a pretty healthy woman, seems to have a lot going on right now. So my questions for you are, what are your top differential diagnoses? What further labs or imaging would you order? If you were to admit this patient, what setting would you admit to? And what are the most important aspects in treating your top differential diagnoses? Which would be your priority?